Good evening, friends. I am Dr. Anirban Basu, consultant physician practicing in Shithi area. Today I am here to discuss a very important topic, that is high blood pressure, in medical term which is known as hypertension, and will be sharing with you a few tips and how to deal with your blood pressure, that is hypertension. So to start with, generally everyone have a healthy normal blood pressure. What exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessels, and this is called blood pressure. Normally, blood pressure usually falls regularly and rises regularly throughout the day. You will have different types of blood pressure reading throughout the day in case of normal blood pressure. But when blood pressure rises and it remains high for a longer period of time, as well as it comes high in subsequent readings of BP monitoring, then we will say that the person is suffering from hypertension, that is commonly known as high blood pressure. So, what are the risk factors for developing high blood pressure? First of all, age. As people get older, the artery gets stiffens up, and due to these stiff arteries, blood pressure usually rises with the rise of the age. Second is the very important thing, that is a family history of blood pressure. A person may have high blood pressure if he or she is having a positive family history, that is, any first blood relative of that individual is having a high blood pressure. Those patients are at very high risk of developing blood pressure sooner or later. The third is excess salt intake, that is added salt, not the dietary salt which we usually use during cooking, but the excess salt intake or intake of excess salty products may rise your blood pressure. The fourth one, that is eating processed food and fatty food, make the heart work harder, and which may push your body to have high blood pressure. And last but not the least, that is the stress factor. In today's world, in this high speed world, we have developed an ample amount of stress element in our day-to-day life, which may lead to have a very high blood pressure. So there are no obvious signs and symptoms of hypertension, that is high blood pressure. That's why we often call it a silent killer. It puts people at several risks or risk of several other disease which is related to high blood pressure for a longer period of time, like cardiovascular problems related to kidneys, fatal strokes, that is cerebrovascular accident, damage to your eye, you may have retinal hemorrhage, or you may have retinal hemorrhage which may cause blindness. So, early and accurate diagnosis of hypertension for management of your blood pressure is very important. Generally, when symptoms occur, you have a little bit of alarming signs, that is morning tiredness, changes of vision, buzzing in the ears, fatigue, etc. High blood pressure can be easily diagnosed. So, for the diagnosis of high blood pressure, let us come to first what will be the normal blood pressure according to our medical guidelines. We all know, as you all know, that the normal blood pressure is 120 upon 80 millimeter of mercury. 120 is the systolic pressure and 80 is the diastolic pressure. So anything around 140 systolic and 90 diastolic may be stamped as hypertension. Though it is a generalized approach, the values of blood pressure may vary according to age, ethnicity, status of the patient and many other factors, but to be just in one line to be defining the hypertension, it is 140 upon 90. First of all, I would like to say you that lifestyle manifestation or lifestyle modification is a very important factor which could prevent you from getting high blood pressure. That is regular exercise, healthy diet, quitting of smoking and reduction of alcohol intake, to manage your stress, and regular blood pressure monitoring at the age of around 30 and above. So if I go for regular exercise and physical activity, you will have a reduction of your BP as well as it will reduce the stress. So what is a healthy dietary plan? Diet also plays an important role for controlling blood pressure. High intake of vegetables, fruits, whole grains recommended for lowering your blood pressure and preventing hypertension. There are certain dietary patterns which I will discuss in just one line, that is DASH diet, that is dietary approaches to stop hypertension, or we commonly say Mediterranean diet. Eating less saturated fat and total fat, getting plenty of potassium supply in your diet, and limiting the intake of sodium, as I have already mentioned, that is added sodium, and limiting or prohibiting any alcohol consumption. So a small reduction of sodium in the diet can improve the heart and health, even to reduce blood pressure by 5 to 6 millimeter of mercury, which is very significant. So if possible, friends, choose low sodium alternative dietary habits, eat fewer amount of processed foods, and don't add salt to your diet. Don't add salt to your diet. So you can have a control of BP, or you can prevent your increase of blood pressure. Quit smoking. Smoking is very important aspect of having high blood pressure, so it is always advised to quit smoking. And please go for regular blood pressure monitoring. If you are having a positive family history of blood pressure, or any family member is having a high blood pressure for which he or she is getting treatment, so the next generation people should always have a regular blood pressure monitoring. Most of us rely upon doctors for monitoring of blood pressure, and due to our busy schedule, due to this hectic work schedule, we often miss to come to physicians for checking of blood pressure. So I will advise everyone to check your blood pressure regularly at home. Nowadays all companies have come up with machines which can monitor your blood pressure, that is your digital BP machine. You can have your BP measured, and whenever any blood pressure monitoring machine is showing a blood pressure of 140 systolic and 90 diastolic for a subsequent period of time, then you please consult your physician or any medical person for control of blood pressure through lifestyle modification as well as drugs. Stress management, you have to relax, you have to manage your stress, improve emotional and physical health. Stress management technique includes your exercise, you can meditate, you can travel, you can listen to music, and you can have yogas and other areas of interest which you feel that your stress will be released. And the most important part, if you are diagnosed of having high blood pressure or hypertension by any physician or any doctor, and he has given you any medicine for control of blood pressure, please try to adhere with the treatment. Don't discontinue medicines without prior intimation or without any information to your treating physicians. The adherence of treatment is very important because blood pressure or hypertension is a silent killer which may cause a huge damage to your system in long run if you don't having your blood pressure controlled. At last, I would like to suggest that there is nothing more precious than to have a healthy and fit life. So, my dear friends, healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways, which I have already discussed in my short discussion. So, please be fit, be healthy, maintain your lifestyle, maintain your dietary habits, check your blood pressure at regular intervals. If you are having a high blood pressure reading for subsequent period of time, please come to us, consult any physician, continue or start medication, and please adhere to the treatment to have a long-term fit and healthy life. Thank you very much for your patient listening. Hope my discussion and my information will serve you to have a good control of your blood pressure as well as to have a healthy and prosperous life. Thank you very much.